Hi, I'm Meghan Bright with Knob Noster Physical Therapy, and today we're going to go over glides for the median nerve. So our median nerve basically starts at the lower portion of our neck, and it's going to run down our arm in this distribution into these three fingers, and then half of our ring finger. So if you're experiencing numbness, tingling in these three digits and half of this digit, you're probably dealing with some irritation to the median nerve. So this can be caused due to soft tissue restriction, bony anomalies that run down the arm. So what we're going to want to do is try to get that nerve moving through its normal range of motion to increase blood flow to that nerve and to decrease your symptoms overall. And the nerve glide is a great place to start with that. So what we do when we're doing nerve glides is we're going to start with what we call a glider. So this is only going to tension one side of your nervous system versus both sides of your nervous system, and it's a very good starting point. My suggestion would be doing 5 to 10 reps of these and then reassessing how your symptoms are feeling. You should have a slight reduction in your symptoms after performing this exercise. So the glider is going to look like this. You're going to have the arm straight out to your side and the wrist bent away, and you're going to bring your head towards that hand there, and then to switch it up, you're going to bring the head away and then bend the elbow there. So here we are tensioning this side of the nervous system at the wrist, and we're slacking this side. And then we go the opposite way, we're tensioning here, and then we're decreasing the tension here. So I'd go 5 to 10 reps, and then you can kind of relax a little bit and then see if that reduces your symptoms. If you are getting reduction in your symptoms, this is going to be a nice exercise to start with, and you can perform it 2 to 3 times throughout the day when you are having those symptoms. As you get further along, you can progress that to what we call a tensioner. And a tensioner is going to basically stress the nervous system on both sides. So now you're going to have the hand here and you're going to go away with the wrist and the head at the same time. And then I would still come out of it, bringing the head this way. And you can bend the elbow if you'd like to. And then I'd go back in. And you want to do like 1 to 2 second holds at each spot. This is a little more aggressive, so I definitely recommend starting with the glider and then progressing to this tensioner exercise. Okay, same thing, I'll keep that dosage like 5 to 10 reps to start. The nerves can be quite irritable if you are too aggressive with this, so definitely introduce it gradually. Okay, and one additional modification, sometimes if the nerve is getting irritated at your neck, you can have pain with moving the neck. So what you can do is just maintain that neutral neck position, and now we're going to use the wrist as our place to tension and take tension off of that median nerve. So it would look like this, to tension it 1, 2, and then you're going to come off 1, 2. So that's another modification if you're experiencing the pain with the movements at your neck. Hope you found these tips helpful for getting some movement in the nervous system there. If you are dealing with this, always feel free to give us a call or reach out to us at knobpt.com. Thank you.